Right, hello again, and away from sports to healthcare in Ghana, the Universal Access to Healthcare campaign has launched the civil society organization's Health Manifesto. We're discussing this health manifesto. We'll find out how it affords the average Ghanaian unfettered access to universal healthcare. My discussant this morning is Archibald Adams. He's a national campaign coordinator for the Universal Access to Healthcare campaign. Archibald, you're welcome and good morning.
Good morning, thank you. Bonnie.
So I've been reading about you, and this is an advocacy campaign.
Sure.
It's a group advocating for quality, accessible, universal healthcare. So for how long have you been doing this advocacy work, and just what form does your advocacy work take?
All right, thank you, and then let me say good morning
Yes.
to your viewers. Universal Access to Healthcare campaign has been in existence for 7 years. We've been doing a national advocacy campaign. We have members scattered all over the country. These members are doing their specific and individual health-focused advocacy. But when we come together, we are pushing for universal health coverage.
So there's an umbrella body?
Yes, so it's an umbrella body.
Okay.
That is what is called the Universal
Okay.
Access to Healthcare campaign. So when we come together as a campaign, what we are pushing for is that everyone, every Ghanaian should have access to healthcare. At the point of need, you don't have to pay for it.
Okay.
We are saying that...
So are we saying it's free universal healthcare?
We are not saying free. What we are just saying is that at the point of need or at the point of use, healthcare should be given. You should have access to healthcare without the issue of financial barrier.
Okay.
What it means is that you had already paid for the healthcare before need of having access to the healthcare.
Okay.
So for us, the campaign, we see the National Health Insurance Scheme as a vehicle to achieving universal health coverage.
Right.
So we are saying that if the NHIS is efficient, if it's running, if we have more coverage rate, everyone can access healthcare because you had paid for it before the need
So
to
how
access.
universal is universal? What's the range that it spans?
Okay, so according to the WHO standard, we should have at least 90% of the population covered for us to say that we have achieved universal health coverage.
Oh, we are a far cry away from there because currently
we have a lot of that the challenge falls on all of us. Over the years, the main challenge of the NHIS has been the late release of funds from the Ministry of Health to the National Health Authority for them to pay their service providers. And I think that if this issue or this gap is closed, we can get the National Health Insurance running and then increase our coverage. By the NHIS Act, it should be done within 3 months. But as I speak to you, you have some health facilities who are being owned by the National Health Insurance Authority for 7 months. And they have threatened to stop attending to NHIS card holders. And that is our problem.
Okay, and so then how do you go about solving such Herculean problems? I must touch on family planning because I'm very passionate about reproductive health. I think too many people die because of unintended pregnancies and unsafe abortions. We know that the 2012 National Health Insurance Act mandated inclusion of family planning services in the benefits package. The law isn't operational yet. I mean, to what do we attribute this delay? And with all the advocacy you've been doing for 7 years, really, what are you doing about this?
Right, so the Act as it stands now gives or mandates the Minister of Health to determine the sort of family planning that can be covered. The context.
Which hasn't been done.
Yes, so the challenge is that it has not been done, but thank God when we had the review process of the NHI in September this year, it came up. And what was agreed upon was the fact that the NHIS was going to cover the clinical methods. So when we say the clinical methods, they are the family planning methods that you have to access at the health facilities.
Okay.
It's not like the condoms or the pills that you can walk into a pharmacy to buy. So you're talking about the IUD, the injections, and all the others. So with this review and then with it being implemented...
We get that, all the big talk, yes. When is the time frame? When is the time frame, the period within which this should have been implemented?
There's an LI which has not been approved yet for the law. So you see, these are a bit of all the legalities. And Unfortunately, we have a new government that is going to review the review report to see how it falls in lines with its manifesto, and then we can take it from there.
I
So that is
imagine the
a
challenge this poses
exactly.
to you, because it means that you would have to establish yet another
Exactly.
rapport with the
Exactly.
new Minister of
Exactly.
Health.
Exactly.
Wow.
So, you know, you would have built a good relationship,
Yes.
rapport with the
Yes.
current government,
Yes.
current Minister of Health, and all the stakeholders. And now you have to wait for 7th January for the new president-elect to be inaugurated, for him to form his cabinet, for the Minister for Health to be briefed, for you to now go there, write letters, get to
You
do
speak
all
like
the
a very
lobbying.
important person. So to what extent has the universal access for, access to healthcare in Ghana, to what extent have you contributed to the 41% coverage range we have for the NHIS?
Right. When the NHIS took off, I mean, before it took off, we did a research to look at how the similar schemes had been operated in other countries. And then we pointed out some things for the NHIA to look out for. But of course, were not paid attention to. And then we started identifying the issues. And what we have been doing over the years was that at first we were seen as traitors. I mean, thinking that we didn't want to be a partner, but now the NHI sees us as a partner. We've identified issues of fraud. We've also made input into their review process. We're part of the committees that review the NHIs at various levels. And then we also made input into the new benefit package. And then eventually, when the NHIS started, everybody was quoting the coverage rate at 67. And we told them that it's not as per those who have registered, but it's those who have registered and have renewed their card.
Right.
I mean, for the first, second
Right.
time. So we did all the consultation, and then we agreed with NHIS that now it's no more 67, but it is 34. So from 34, we have been working with them from 34 to the 41 now.
I see. So obviously you do a lot of scrutiny and reviews. So let's have your take on this. In the run-up to the elections, we had political parties, making all sorts of Herculean promises as regards, accessibility to quality healthcare. Did you take your time to scrutinize political parties' manifesto promises as regards healthcare?
Yes, we did.
You did.
We did.
May I ask which was most promising and which was most realistic? Say it as it is. I would love to know.
Yes, we looked at, the 4 key political parties. We looked at the NDC, we looked at the MPP, and we looked at the CPP and then the PPP. PPP was more focused on the preventive measure, talking about public health education, national spraying exercise, so that we could deal with the issue of malaria and cholera. For PPP, it's a shame that as Ghana turns 60 next year, we still have to battle with malaria and cholera and then all the other sanitation-related problems. When you look at the CPP, they are looking more at ensuring that the NHIS, which is our focus, is managed by people who are not politicians. And for us, it's a good thing. And then when you look at the NPP, they were looking at making sure that the funds that are received, the taxes that you and I pay through the NHI levy, the 2.5 levy, goes directly to the National Health Insurance Authority.
And not to the coffers first.
And not the coffers of government or the national chest for it to be disbursed. And then one major thing that the NDC said they were going to do was to allocate some portions of the oil revenue to the healthcare or National Health Insurance Scheme. So on a scale, when you place all these, they all look very good. Our concern now is that we have a new president, we have a president-elect.
Archibald, you're a healthcare advocate. Among these 4, which is most promising and which is most realistic?
We had gone for the preventive healthcare because
that's the PPP.
Yes, because a lot of the illnesses that are reported at our OPD are the basic things that can be prevented. And if they are prevented, there'll be less pressure on our health facilities. There'll be less pressure on our health, our budget or our pairs for NHI, and then we can take care of the other diseases
Okay,
as well.
but is access to healthcare as important to the electorate as we think it is? Because I can dare say that if you asked any person about some of these campaign promises that political parties make, they can readily rattle the one district, one dam, one village, I'm sorry, one district, one factory, one village, one dam, etc. Not many would be able to tell you exactly what these parties said as regards healthcare. Does it not mean that this message of healthcare really doesn't resonate with the average Ghanaian you're fighting for?
It will interest you to know that the NCC survey that they did,
Yeah.
health was the third important thing to the Ghanaian electorate or Ghanaian voter.
I see.
So you could see that it was jobs, it was about education,
I
and it was
see.
about health.
Health.
So obviously, the one district, one dam, one district, one farm will be a top priority because a lot of people are crying for jobs. And then also the education comes in, and then healthcare. During all the national debate, the NCC and then the IEA, health came up. And then we've also been pushing with our partners scattered all over the country, pushing for healthcare. And I'm very sure that some people listened, some people actually scrutinized the health policies of the various political manifestos, and they did consider before voting.
I see. Well, you've launched the Civil Society Organizations Health Manifesto. How wide and far did your consultation with civil society go?
Okay.
Before, reaching this conclusion?
Okay, so we had all our partners who are scattered all over the country collect views and opinions from Ghanaians to look at what for them is their concern when it comes to health. And then we did put together, we had a consultant who had to do a validation, making sure that these views are really the majority, the views of the majority of Ghanaians. And after it was put together, we went back to the people to educate them on it. And then we also did some consultation with our stakeholders, the political parties, the media. We got some political parties to even sign pledge cards indicating that when they come, they are going to run along their manifesto with the CSO's
Good question.
manifesto.
I'll come to that. But most importantly, you've been able to enumerate basic health needs of the average Ghanaian. What are some of them?
I mean, the basic health needs of the average Ghanaian, or the majority Ghanaian, is access to healthcare. Access to healthcare. The next thing that comes up is affordability. There's really no point in having all the huge health facilities and then not being able to pay for it. And when you look at the WHO features of what it means to have access to universal health coverage, it means that there's access, geographical access to health facilities, there's access to quality of health professionals, and what it also means is that there will have been equitable distribution of health professionals across the country. There's affordability, you being able to pay for the health care, and then availability of drugs.
Because I think we should be able to strike a balance between accessibility to quality healthcare and the availability of healthcare facilities.
So for the average Ghanaian, their concern is access, their concern is affordability, and being able to be examined or be attended to by a qualified
So then what's your strategy? Because clearly lobbying and advocacy will not be enough. We can't strike a balance between accessibility to quality healthcare and the availability of these healthcare facilities.
So I mean, one of the strategies we've been using is engagement. We really can't pass the laws. We really don't have the money to implement these policies. So we do engage the people that have the power, the people that have the mandate, and we will be coming to the president-elect and we'll be coming to the new health minister.
I wanted to ask if there's a correlation between the Civil Society Organizations Health Manifesto and the promises captured in the MPP's manifesto. Because clearly it must be one and the same thing. Otherwise, theirs takes precedence over yours.
Exactly. One of the key things about the NPP's health policy is to increase budget allocation to the NHIS and making sure that all funds that are raised to the NHI levy goes directly to the National Health Insurance
How does that
Authority.
tie in with your health manifesto?
It is going to help because the challenge we have with the NHIS is a late release of funds. So then if funds are going to go directly to NHIA, then they don't have a problem or they don't have an excuse not paying their service providers, and then people will have more confidence. People will register with the NHIs, and then we can get to the 90% or more.
So you must be
stipulated.
ecstatic that President Mahama has decided to allocate a portion of the oil revenue.
I mean, we
to
were
the
excited. We
NHIS.
released
Yeah.
a press release on that. I mean, and for us as advocates, we are hoping for the best. So we're praying that the elections will be peaceful, which it has been, and then we'll be coming to the president-elect and then to the new health minister.
Thank you very much. This is all time will allow for Archibald Adams, National Campaign Coordinator, Universal Access to Healthcare Campaign. All right, you're watching New Day.